Welcome to MDnews.com. I'm Charlie Milburn. We're coming to you from San Diego, California at the site of the American Hospital Association's Leadership Summit. One of the hot topics for medical executives here was electronic medical records. We spoke to several of them about the successes and the challenges that they faced in implementing this system. Take a look.
The state of EMRs is in flux. You've got some hospitals that are just now getting started and other ones that are very advanced, which creates quite a national challenge whenever you come to how are we going to meet their needs.
I would say it's again that adoption, the adoption success rate. Back in 2004, it was very challenging to train caregivers, train our physicians and other providers, because many of them had not or were not even proficient utilizing a basic computer. So we had that adoption hurdle really to kind of to jump over 6-7 years ago. I think now it's really being able to master the sophistication of many of the systems that are out there. Back in 2004, the systems were relatively simple. Now there's many advanced features. And again, it's that adoption rate and having your providers and caregivers get very comfortable using it.
I think the biggest challenge is understanding. I think when I look at and hear what's going on, and back to my comment about how EMRs aren't, and certain HIT technologies aren't where they should be, what we're doing is we're asking people to completely change the way they work and adopt a new technology. I think the technologies have to start with version 1. Let's start with meeting the clinicians where they're at, getting them addicted to these technologies, and then growing from there. You know, there weren't 1,000 iPhone apps when iPhone came out. There were just a few, and as people adopted them and found new ways, things grew. I think the challenge and even the initial high-tech bar that was set kind of made the assumption that people would be able to make a leap. And I think what I'm seeing now in the relaxation of the meaningful use criteria is allowing people to step phase into a healthier future, and not forcing them through such a pace that they're not going to end up being able to build on what they just implemented. I mean, so I think we've got to streamline some technologies, and I think we really have to understand what the users want and need and will use.
Well, I think that, you know, one of the insights that is fairly recent as people try to adopt the electronic record is that it's very time-consuming for the physician, and functions that used to be done by ancillary personnel now fall on the physician to have to do it himself. In addition, we've found that patients are not necessarily enamored with the idea that while they're in the room talking to their doctor is not looking at them. He's typing on a computer screen. He's not making eye contact. But if he doesn't do it while he's with the patient, it adds too many hours to his day for him to be able to get his work done. So there are unintended consequences to this that relate to patient satisfaction. The other thing to me, it seems to me that we've all had the experience with our own computers at home, and you know, you roll your mouse and you think you're clicking, but the ball rolled right when you clicked, and it clicked on the next thing instead of the thing you wanted. And that happens when doctors are ordering medication. So I'm trying to order 3 milligrams of morphine, but then as I click down, it hits 6 milligrams of morphine. And you know, it's in the computer, so it must not be an error. And you know, that's a problem. The other problem that I've identified and I'm very concerned about has to do with cutting and pasting notes. And part of the teaching process is for the residents to make rounds on their patients and write a daily note. Well, with cutting and pasting, you can just, you know, take yesterday's note. And so you look at some medical records and the patient has exactly the same heart rate, blood pressure, respiratory rate for 14 days every daily note. And then some of the consultants who want to save a little bit of time are cutting and pasting, and it really can have the unintended consequence of having the medical record not be as accurate as it might have been doing it the old-fashioned way. And the other thing is that nurses' notes are very difficult to discern in most of the electronic records I've seen. It's such a voluminous amount of checklists, negatives, et cetera, that You know, in the old days, you could pick up the chart. I wonder what happened to this patient at 3 in the morning. And there's an entry from the nurse's note that says 3 in the morning and patient agitated or whatever. Now, you know, you try to look through the nurse's notes. It's 4 screens of tuberculosis screening, handrails are up, and all kinds of other data that, you know, it's like the Pentagon. When they don't want you to know something, they just send over a truckload of documents and you go find what you're looking for. I mean, it really can get very dicey in trying to get the information that you're looking for.
So now that we've heard what they have to say, we want to know what you think. Click on the link below that says share your perspective to let us know what you think about electronic medical records. Reporting in San Diego, this is Charlie Milburn for MDNews.com.